Hello, I'm Dr. Richard Swift. I'm a board-certified plastic surgeon here in Manhattan, and I would like to talk today about liposuction of the neck. Some people call it the chin, but it's really this region here, the submental area. And I would like first to talk about good candidates for this. Often the patients are on the younger side because to do this properly, you want to have good elasticity of the skin. And that means that once the fat is removed, the skin will snap back. And sometimes with older patients, they have inelastic skin. And although you remove the fat, then they're left with another deformity of sagging skin. So in those cases, that's a different topic. I would liposuction them and do a lift to remove the excess skin and tighten up the neck. But if the patients are younger and they just have fat in this region here, it can be liposuctioned. So let's talk about the process. Obviously, the patient's going to come in and have a consultation with me, and we're going to review what the patient's concerns are and their goals. And so this is good. Next, we decide for surgery. Surgery, this is what it looks like. The patient comes in. Usually I give them a little something because almost always I do this under local anesthetic, men and women. So that's a bold statement there, because if I could do this for guys, I could do this for women. But anyway, we almost always do this under local anesthetic. If they want to, they could have intravenous sedation, or we're combining with other procedures like, say, a chin implant. And sometimes I would say, in that case, I would just do it with sedation. But anyway, getting back, the patient comes in, they'll take something oral for a little sedation, and they're relaxed. Then we go to the operating room, and then I'll prep the area, put some iodine on that area, and numb up these areas and make little openings. And the beauty of liposuction is that the fat is extracted in the subcutaneous plane. And by that I mean between the skin and the underlying muscles, that's the only area that we're really gonna go. And it's pretty obvious, as a plastic surgeon, what this plane is, this space is. And what I do is make little openings, and then I put in something called wetting fluid or tumescent fluid, and that's going to make the tissue firm. So when we do the liposuction, the fat can be extracted and the tissue's just not moving around. What's in the wetting solution? Well, there's saline, it's salt water. There's going to be adrenaline, epinephrine, and there's going to be lidocaine or numbing medicine. So I'm going to put that in there and let it wait for a few minutes, let the blood vessels constrict. You can see like a blanching or lighting in that area, lightening of the skin often. And then I'm going to liposuction it. And so at that point, the patient's kind of relaxed. And I tell them, okay, I'm going to turn the machine on. You're going to hear a little noise. I usually put like a little gauze there. They can peek if they want to, but otherwise they're pretty calm. But they're not going to feel anything. This ear is totally numb. They're not going to feel it. Maybe some pressure, but it's nothing sharp and nothing painful. And the way the liposuction works is that here's an example of something called a cannula, or a little tube, a little opening at the end connected to a hose. And what goes on here is that it's done bluntly, and there's a very small instrument. That's why I make small openings. And as you're passing through it, the blood vessels and any nerves, they're just go by. Nothing, they don't hurt anything. It's not like a sharp object going through. And it just extracts the fat. And I make sure that it's done all smooth and evenly. I pinch it up, look at it, and I can feel that there's skin, a wisp of fat, and we're down to the muscle. And then it's going to contract. So I finish that up, and then I take a little piece of, protective little piece of foam here, and then I put a compression garment on. And this is what the compression garment looks like. And it's there, and it's going to compress the area. Why do we compress it? Because what gets traumatized a little bit is these little veins. And veins are very, sometimes broken a little bit, but pressure, if you notice the veins in your hand, just putting a little bit of pressure on there, it stops it. And that's the purpose of a compression garment. And that remains on for 5 days. Just 5 days. And it's kind of amazing. And people, they leave my office, they're wearing like a hoodie, sunglasses, and let's be realistic, this is New York. You have to do a lot to get people's attention here. So for 5 days, they sort of hang out with this chin strap. Looks like they have like a toothache, they're walking around. And then they come back and see me. And it's kind of amazing when we take the chin strap off, how well the skin already is contracted. And almost always I get an unsolicited wow. They're very impressed because it looks so good. And you just take the little stitches out, and the skin, because they're young, the elasticity, it just contracts down to the underlying structures. And that's basically it. There's no more wearing of chin straps after that. I tell people to refrain from exercise for a couple of weeks just because you don't want to get a hematoma or you don't want to get more swelling, because after a week or two, you're probably okay, but if you do a lot of activity, sometimes it gets a little puffy. But that's it. And the theory behind this is that there are extra fat cells in these areas, and by extracting the extra fat cells, often hereditary reasons we have them, it is corrected. And these days, we're taking selfies, putting our chin down. It really, just this little bit shows up, and it sort of mars the pictures. You don't want to look at them. So this way, we can remove that, and the patients are very happy with it. There's a very, very high patient satisfaction with this procedure. And the patients, in terms of post-operative pain, is very little. I usually give something called Celebrex. It's a non-narcotic. It's an anti-inflammatory and anti-pain medication. And then I usually give something called Tylenol number 3, and that's like a Tylenol with a little bit of narcotic. And between those two, I just give them a few of those pills just in case. I think often the fact that they have these around, just a few pills, they go, well, if this got worse, I could always take one. But they rarely ever have to take anything like that. And they take antibiotics for a few days. Other than that, I think they're okay. If you have any questions about this, I recommend that you have a consultation with me. You can contact my office, and I'd be happy to see you. Thank you.